Okay, pancreas. Remember, to find the pancreas, what you're going to do is take the greater omentum and lift it back. Let's get these intestines out of the way. And when you lift that back, you're looking under the stomach between the liver and the spleen. And this glandular material looks like cooked ground beef. It's nodular and it's brown. And you got your pancreas. And you got the head of the pancreas along the duodenum, the body of the pancreas under the stomach, and the tail of the pancreas next to the spleen. Okay. Now we're going to skip adrenal glands for now because we're going to find those with the urinary dissection because they are retroperitoneal as well. And then ovary and testes. I can't show you ovaries, this is a male cat. So I'll come around the room for those that have females and point those out, and then you can share the information with your other teammates. But the testes are in the scrotum, and that's going to be a dissection for next time as well when we do urinary and repro. Okay, so you've got oral cavity, nasocavity, nasopharynx, oropharynx, hard palate with bone, soft palate, and then beyond the soft palate, this common area is laryngopharynx, and then anteriorly you have the larynx and trachea, posteriorly or dorsal you have the esophagus, and this connective tissue piece, cartilage piece with elastic cartilage is the epiglottis to cover the airways when we swallow. We also have the tongue and the lingual frenulum that connects the tongue to the floor of the mouth. Those have brain structures in there. Interesting. Alright, we can also see the trachea anteriorly and the esophagus posteriorly, this is belly side, in the body end. Okay. And you can see the esophagus is a collapsible tube, whereas the trachea is always held open. Epimysium came with it, but this roundish kind of ball of muscle on the side is the masseter. Okay. Now the tissue over the gland, you don't usually want to use a scalpel. You want to just try to grab it with your forceps and kind of peel it from the parotid gland. Because if you use the scalpel and you go too deep, you'll peel this gland right off. Okay, so you can see how I'm just gently removing this superficial layer. And there's our nice parotid gland there. Okay, now the submandibular is going to be right underneath that. So again, we have some tissue here to remove. This is hard to do without someone holding this for me, but pull and remove. Get between the tissue and the gland. Like that. Okay. And there's our submandibular gland. The vein going through there. Okay, submandibular, parotid, masseter muscle.